Healthcare providers in Ohio will soon have to show you upfront dollars and cents pricing for your care. That is thanks to a new state law requiring hospitals to post prices for patients.
But another way that law could help you is with health insurance. News 5 investigator Jonathan Walsh, who's been reporting on medical pricing problems now for years, has our latest cost of coverage report.
Yeah, and Jonathan, how could this affect insurance coverage?
Well, guys, for that answer, we went straight to the guys who drafted this law right here in Ohio. And the law gives patients information that wasn't known before, or maybe murky at best, and now lending them more power in all aspects of billing.
I feel very disappointed, and I feel like there's a lack of transparency.
It seems like the healthcare price transparency law right here in Ohio was built for people like Becky Schreier from Talmadge.
My assumption was that that was going to be the amount for the hospital services since I received an estimate.
You see, she got an estimate for recent care at Summa Health of about $7,500 and paid it ahead of time with $1,500 for hospital services. However, after the appointment, she got another bill telling her she owed an additional $5,100 for hospital services. She was angry.
I would have rather been billed the full amount up front. That would have helped me to decide if I actually wanted to go ahead. And it was an elective procedure.
In Becky's paperwork, it does say the estimate is not guaranteed, but she points out this isn't a couple $100. It's more than $5,000.
It was a lot of work, put all my passion and hard work behind this.
Ohio Representative Tim Barhorst is a joint sponsor on the state's new law that forces providers to list dollars and cents pricing and the cost with or without insurance.
By taking the gray out of it and putting the light on it, that will give us a true free market and a functioning market in healthcare.
Representative Ron Ferguson is the other joint sponsor.
But we were the first to have this large sweeping legislation to guarantee prices for patients.
In light of the recent frustrations with the overall health insurance industry, here's how the new law can help you. The prices are clear. If insurance companies come back to you asking for more, you can point to the costs in black and white.
Previously, the insurance company and the patient are just taking algorithms from that third party, from that hospital, and trying to make heads or tails of them.
Ron tells us often the scenario was the insurance company sees it one way and you see it another.
How do you possibly arbitrate that? And this is going to give us the ability that it's very clear-cut, concise, common sense right in front of you.
Recent Gallup polls show only 28% of people feel healthcare coverage is good or excellent. And for Americans' health problems, cost and access to care are top concerns. When taken together, they outweigh the next 6 categories combined, which include things like mental illness and cancer. With this new Ohio law,
there's still going to be some onus on the patient. You're going to have to do your homework, but now you have the ability to do the homework.
Becky thought she had done her homework by getting an estimate. After News 5 investigators connected with Summa Health, Becky says Summa told her there was an error, and she no longer owes the extra thousands of dollars from the second bill.
When they send you an estimate, the whole amount should have been in that estimate.
And get this, Becky says she's now dealing with a questionable estimate for her anesthesia as well. The transparency law is slated to go into effect in early April. Representatives of the insurance industry have told us they're reviewing every option they have to fight this law. Stay tuned. We're going to stay on top of it. In the meantime, if you've had problems with health insurance companies, whether it be denials, delays, surprise billing, whatever, we want to hear from you. Call our investigator tip line, 216-431-4357, or email us at investigatortips@wews.com.
A topic there certainly is no shortage of stories on. Jonathan, thank you so much.